This will be the beginning of Chapter 10. We're going to briefly look at the muscular system. So skeletal muscles produce movement by exerting force on tendons, and these tendons are going to be attached to bones. When a skeletal muscle contracts, it moves the articulating bones. Now, the two articulating bones usually don't move equally in response to contraction. Now, ordinarily, the attachment of a muscle's tendon to the stationary bone is called the origin. The attachment of the muscle's other tendon to the movable bone is called the insertion. A usual rule of thumb is that the origin is usually proximal and the insertion is distal. Usually it's going to be the insertion that's pulled toward the origin. The fleshy portion of the muscle between the tendons is called the belly, if we're looking at the biceps brachii muscle right now. And the actions of a muscle are the main movements that occur when the muscle contracts. So looking at the biceps brachii here on the arm, we can see the origins are on the scapula. The insertion is on the radius, and so the radius is going to be the movable bone, the bone that moves closer to the origin, which is the scapula. And the scapula does not move when the biceps brachii contracts. Now, in producing movement, bones act as levers and joints function as the fulcrums of these levers. So just a couple definitions here. A lever is going to be a rigid structure that moves around a fixed point called the fulcrum. Then our fulcrum here is going to be our fixed point that the lever moves around. Now, a lever is acted on by two different points by two different forces. We have the effort, which causes the movement, and the resistance or load, which opposes movement. This is also called the load. This is a bracket here. So again, effort is going to cause movement, and the resistance or load is going to oppose movement. So the effort, this is going to be the force exerted by a muscular contraction. The load is typically the weight of the body part that's being moved or some resistance that the moving body part is trying to overcome, like the object, like the weight of an object. So like in this picture on the left here, we can see that the load is this little blue box. And so this is going to be the weight of the object plus the weight of the forearm. The fulcrum here in this example of the movement of the forearm lifting a weight, the fulcrum is the elbow joint right here. And then the effort in this example is contraction of the biceps brachii to move the forearm. Now, the relative distance between the load and the fulcrum at the point of which the effort is applied determines whether a given lever operates at a mechanical advantage or a mechanical disadvantage. So mechanical advantage, this occurs if the load is closer to the fulcrum and the effort is further from the fulcrum. So the load closer to the fulcrum than the effort. Then, in these cases, only a relatively small amount of effort is required to move a large load over a small distance. On the other hand, with the mechanical disadvantage, this occurs if the load is further from the fulcrum and then the effort is applied closer to the fulcrum. So in these cases, a relatively large amount of effort is required to move a small load. So with this in mind, the mechanical advantage versus disadvantage, levers are categorized into three types, and this is according to the positions of the fulcrum, the effort, and the load. So the first classification or first category that we have here is a first class lever. So this is when the fulcrum is between the effort and the load. So scissors and seesaws are going to be really good examples of first-class levers. So these produce a mechanical advantage. Or they could also be produce a mechanical disadvantage. And this is depending whether the effort or the load is closer to the fulcrum. So if the load here, say, is 2 meters away from the fulcrum, and the effort, just for example here, is going to be 3 meters away, then this particular type of first-class lever is going to have a mechanical advantage because the load is closer to the fulcrum than the effort is. So the movement of the head here would be an example of a first-class lever, with the fulcrum being the vertebrae, the load being the weight of the head, and then the effort here being the contraction of, it looks like the splenius capitis muscle back here. Next we have the second class levers, and this is where the load is between the fulcrum and the effort. So second class levers are going to operate like a wheelbarrow like we have here. Now, second class levers will always produce a mechanical advantage. And this is because the load is always going to be closer to the fulcrum than the effort is. So standing on your toes would be an example of this type of second class lever. Here the fulcrum is your toes, the load would be the weight of your whole body essentially, and the effort looking like your gastrocnemius muscle in your calf here. Then lastly is the third class lever, and these levers will operate like a pair of forceps. These are going to be the most common types of levers in the body. So this is where the effort is applied between the fulcrum and the load. Now these types of levers will actually always produce a mechanical disadvantage. And that's because the effort will always be closer to the fulcrum than the load is. The biceps brachii muscle moving your arm is going to be an example of a third-class lever. The effort being applied being the contraction of the biceps brachii, the fulcrum being your elbow joint, and the load being whatever you're holding in your hand or just the weight of your forearm. Now recall that skeletal muscle fibers within a muscle are going to be arranged in these bundles known as fascicles. Now within a fascicle, all of the muscle fibers are parallel to one another. These fascicles, however, they may form one of these 5 patterns with respect to tendons. So these patterns are parallel, fusiform. So fusiform means like spindle shaped, where it's narrower towards the ends and wider in the middle. Could be circular, triangular, or pennate. Pennate means shaped like a feather. Now, this arrangement that they could have, these 5 different types, really is correlated with the amount of power a muscle can produce and also the ROM, or the range of motion that a muscle can produce. So as a muscle fiber contracts, it shortens to about 70% of its resting length. The longer the fibers are in a muscle, the greater range of motion it can produce. So longer fibers equals a greater range of motion. However, the power of a muscle does not really depend on length, but it depends on the total cross-sectional area. And this is because a shorter fiber can contract as forcefully as a long one. So the more fibers per unit of cross-sectional area that a muscle has, the more power it can produce. So greater cross-section equals more power. So here we have a nice little table with the different arrangements of fascicles that we find in the body. So here we can see parallel, we can see a circular, we can see fusiform, that kind of spindle shaped, triangular, and then a couple different types of pennate. So pennate muscles, for example, these are going to have large number of really short fibered fascicles that are distributed over their tendons. So these types of muscles have great power, but a decreased range of motion. In contrast, the parallel muscles over here, these have comparatively fewer fascicles, but they can have really long fibers that extend the entire length of a long muscle. So these ones can have a greater range of motion, but less power. Now, movements are often the result of several skeletal muscles acting as a group. Most skeletal muscles are going to be arranged in opposing pairs at joints. This is going to be an important point here. So we're talking about things like flexors and extensors, abductors versus adductors. These are going to be opposing pairs across a joint. Now, with opposing pairs, one muscle called the prime mover or agonist, this is going to contract to cause an action. While the other muscle, the opposing muscle, which is called the antagonist, this is going to stretch and yield to the effect of the prime mover. In the process of flexing your forearm at the elbow, for example, your biceps brachii is the prime mover and the triceps brachii is the antagonist. The antagonist and the prime mover are usually going to be located on opposite sides of the bone or opposite sides of the joint. Now, to prevent unwanted movements at intermediate joints or to otherwise aid the movement of the prime mover, muscles that are called synergists contract and stabilize the intermediate joints. So an example are muscles that flex the fingers, which are the prime movers. These cross the intercarpal and radiocarpal joints. So intercarpal and radiocarpal joints, these are going to be considered intermediate joints. So if movement at these intermediate joints was unrestrained, you wouldn't be able to flex your fingers without flexing your wrist at the same time, because those muscles that flex your fingers cross all of these joints. So we have these synergists to kind of restrain those intermediate joints so that you don't have to flex your whole hand and wrist at the same time. So let's briefly discuss how skeletal muscles are named. Most of the names of these skeletal muscles contain combinations of the root words by their distinctive features. So this works in two ways. So you can learn the names of the muscles by remembering the terms that refer to muscle features, such as the pattern of the muscle's fascicles, the size, the shape, the action, the origin and insertion, or location. You can use all of these to help memorize muscles. And knowing the names of a muscle will then give you clues about its features. So let's look at some examples of this. So here we have a nice table of the characteristics that are used to name muscles. So this is really helpful, so you don't necessarily have to memorize every muscle, but you can memorize the characteristics, and that will help you to determine the name of the muscle. So things like direction is used. So rectus here means parallel to the midline. Transverse, meaning perpendicular to the midline. So examples of these would be like the rectus abdominis. So these are abdominal muscles that run parallel to the midline. Transverse abdominis, these are abdominal muscles, again, that run perpendicular to the midline. Another characteristic would be size. So things like maximus, minimus, longus, brevis. These are largest, smallest, long, short. Examples would be things like the gluteus maximus, gluteus minimus, adductor longus. So the adductor longus is a muscle that adducts, and it's a long muscle. So kind of just use these characteristics in order to help you determine what the muscle does and its location as well. So shape would be another one, deltoid being triangular, trapezius is trapezoid shaped. Lots of different examples here that you can use to study. Here are some other characteristics, the actions, so things like flexors and extensors. The flexor carpi radialis. This would be a flexor muscle that goes over the carpus and the radius. Extensor muscles, extensor carpi ulnaris, same thing. Extensor muscles that go over the carpus and the ulna. So really good ways to kind of know how muscles are named. This will be really, really helpful more so in the lab portion in memorizing all the muscles of the body. Don't necessarily have to memorize all the muscles of the body, though that helps, but also use these characteristics that we use to name muscles to help you to remember all of them. So here in this picture, we have a lot of these superficial muscles. We will look at these a lot more detail in the lab, but here you can see things like the rectus abdominis here. So these are, again, abdominal muscles that run parallel to the midline. We see things like the deltoid, which is a triangular muscle named after its shape. Or the triceps brachii. So tricep meaning that it has 3 origins. Tri meaning 3 origins here. Here we have some superficial posterior muscles. Things like the gluteus maximus, large muscle on the buttocks, the latissimus dorsi, which is a wide, very wide muscle on the dorsal surface or the back surface of the muscle. So again, just using all of those root words to help you to determine where the muscle is and help you determine those muscle names. So very briefly, we're just going to go over some running injuries. So some running injuries can be relatively minor, but some can be quite serious. And if left untreated or treated improperly, minor injuries can become quite chronic or long-term. Now, running injuries are frequently related to faulty training techniques, which may involve improper or lack of sufficient warm-up routines, running too much, or even running too soon after an injury. Now, most sports injuries are treated with a thing called PRICE therapy, and PRICE stands for protection, rest, ice, compression, and elevation. Now, follow-up treatment after an injury may include massage to improve blood flow to the injured area or medications. Things like NSAIDs. These are non-steroidal anti-inflammatory drugs, things like ibuprofen. These are also very helpful. Or corticosteroid injections may also be helpful for running injuries, helpful for pain. Now, during the recovery period, it is also important to stay active using an alternative fitness program that does not worsen the original injury. Now, skeletal muscles in the limbs are organized into functional units called compartments. Now, in a disorder called compartment syndrome, this is where some external or even internal pressure constricts the structure within the compartment, resulting in damaged blood vessels and subsequent reduction of blood supply to the structures within the compartment. Now, one treatment called a fasciectomy. This is a surgical procedure where the muscle fascia is cut to relieve pressure. Now, if left untreated, compartment syndrome can result in really severe tissue and nerve damage. So an external force that could cause compartment syndrome would be a physical crushing injury, like crushing your arm or leg under some type of machinery. That's going to restrict or be a pressure, an external pressure that restricts blood supply to the muscles within the compartment. an internal reduction or internal pressure that reduces blood supply. Could be something like a tumor or a blood clot that causes reduction in blood supply to the compartment as well. Both internal and external forces would result in compartment syndrome. Okay, plantar fasciitis. This is also just called painful heel syndrome. This is an inflammatory reaction due to chronic irritation of the plantar aponeurosis. Aponeurosis is just another term for the fascia around the heel, around that heel bone. And this is going to be at the origin on the calcaneus. Now treatments are going to include things like ice and heat alternating, stretching. Remember, not stretching cold muscles, but stretching warm muscles. Weight loss, prosthetics, steroid injections, and sometimes even surgery if the plantar fasciitis is bad enough. And that's going to be the end of Chapter 10.